Some stakeholders in the health sector have advocated for an open license for the generic production of life-saving drugs to make them affordable. The stakeholders made the appeal at a news briefing organized by AIDS Healthcare Foundation in Abuja. Country Program Director AHF Nigeria urged US-based pharmaceutical companies like Gilead to stop evergreening patent on HIV and AIDS drugs like Truvada.
One of the demands that AHF is making across the world, is that the evergreening should stop to allow countries that can produce many medications, particularly antiretroviral medications like Truvada. When this license is opened up, which is our second point, we open up these licenses for even generic production of not just antiretrovirals or anti-HIV drugs, even drugs as important as drugs for hepatitis C. These drugs are very expensive. However, when they are made in a generic manner, they become more affordable. So we're talking about opening up of the patency by Gilead for antiretrovirals, for hepatitis C medications, and treatment for cryptococcal meningitis. And then making sure that there's improved access to these medications.
Ms. Oluwakemi Badamosi, Director for Advocacy and Marketing for Africa Bureau AHF, said Gilead should be held accountable for placing a price on the most effective, modern, and life-saving medicines.
AHF, as a global organization, it behoves us as well as other organizations and even individuals and entities to call out the greedy profiteering of pharmaceutical companies. Companies like Gilead. Gilead is notorious for actually profiteering and putting their profit before people's lives. If you are constantly faced with having to battle high prices of medication, how then does it become easy for you to actually ensure that more people have access to healthcare? What this means is that the more the greed of pharmaceutical companies like Gilead continues, the more it is impossible for a lot of people who should have access to medications that are life-saving. It will be impossible for many people. It continues to be out of the reach of so many people.
I think it is also important that we also look at the lives of people, the people that you are producing these drugs for should be the number one before your profit. Because if these lives are not there tomorrow, I don't think that they are going to make their profit. And I'm happy that this advocacy has started not just in Nigeria, but it's a global advocacy that is going on.
The governance system in every country, especially Nigeria, must be serious with the business of governments to make resources available to fund public health institutions.
Mr. Michael Edo, advocacy specialist, Network of People Living with HIV and AIDS in Nigeria, urged the Nigeria Institute of Medical Research to wake up to more research in producing local vaccines for citizens. Stakeholders present at the event include Nigerian Network of Religious Leaders Living with HIV and AIDS, Network of People Living with HIV and AIDS in Nigeria. I am Joy Obaya, News Agency of Nigeria.